Good afternoon. Thank you for joining us for Facebook Live from Grace Health. What our topic today is going to be talking about all the amazing services that Grace Health has in the OB and GYN, which is gynecology. Today, I'm Patty, and I'm a nurse midwife at Grace Health, and I have Kristen, community health worker, that is an integral part of our programs, both OB and GYN.
Hi, welcome everybody. And just to give a little background about what a community health worker does at Grace Health is our role is to connect our patients and families to our community resources. So Patty's going to introduce what our services are for OBGYN.
So this past year, Grace Health has taken care of over 800 women that were pregnant, and we have 3 nurse midwives and 1 physician that does that care. But within that care, we have an incredible family of co-workers that are nurses, medical assistants, secretaries, everybody. It takes all of us to take good care of all these patients. But probably what we would say over and over from our midwives' point of view is we cannot do this job without our community health workers. They know all the extra things behind the scenes that are available to our patients. And I can say personally, I've worked in probably 4 or 5 other OBGYN practices, and never have I worked in a practice that had such services available to their patients. And those services are amazing. And Kristen's going to talk about some of those things that she provides for just generally our OB patients.
So some of the resources as a community health worker that we can connect you to the resources in the community, we want to make sure that our patients make it to their appointments, and we do that with connecting you to various transportation resources. That can be helping a patient arrange a ride through their health plan, or connecting them to resources like Handyvan or Community Action. We also will help connect you to food resources. We have a lot of great food pantries in our community, and many of them provide the fresh foods. For example, we have one partnered with the food bank every Monday from 9 to 10 a.m. at the church right across from Grace Health. We also will help connect patients to WIC, assist with ensuring that you're enrolled in food assistance if eligible. Some other resources that we can help with are providing education on our sliding fee discount or Medicaid eligibility to ensure we can meet your healthcare needs. We can connect you to clothing, housing resources, utility assistance, employment and education, and also something called family care needs. So what that is that we can connect to diaper resources, formula, chore provider resources if eligible, help with car seat and pack and play referrals. So these are all the resources that we can assist throughout Grace Health, but also specifically with our OBGYN patients.
So when we are thinking OB care at Grace Health, one of the really important things that we want to make everybody aware of is you come in for prenatal care early. The earlier you get into care, we know that the outcomes for healthy babies and healthy moms is much greater. We do know that when people delay their care or just show up at the hospital at the end of their pregnancy, there's higher risks for morbidity or bad things to happen to babies, or even the mother to have health issues that maybe were unrecognized that we could catch very early and help you and your baby. So the minute you think you might be pregnant, we would love for you to come to Grace Health. We do free pregnancy tests. We could find out if you are pregnant, and if so, we would love to establish care for you. The other thing is within the OB care that we have at Grace Health, we have like 2 arms. We have the traditional kind of OB care where you come in for a visit and you see a provider and then you go home. And then Grace Health, and nowhere else in the city of Battle Creek, we have a program called Centering. In that program, to provide OB care, it's like group prenatal care. That sounds very simple, but it is even better than that. You meet with other patients in that family dynamic, your family is defined by you. It could be a friend that comes to the prenatal care. It could be the father of the baby. It could be the boyfriend. It can be the grandma. It can be anybody that you deem is a support for you during the pregnancy. And we encourage you to come to those visits with your family. And in those visits, much more intense than just the regular routine back and forth visits, the education is phenomenal. We have two midwives that work in that area, Krista and Alyssa, and they have extensive education in a more relaxed way, and they teach you all kinds of things that you need for yourself through your prenatal care, and things that we will anticipate that you'll need once you become a mom and you take your baby home from the hospital. The other thing about that program that is so cool is they have snacks at the visits and fun things. They do fun things. They could take a trip up to the hospital to see where you will actually be delivering your baby. And they talk about all the options and things that are available to you in the actual birthing process. It is a wonderful program. They have so we've had so many patients over the years that were in the program earlier, many years ago, and still speak very highly of it, and how that particular group kind of prenatal care actually helped them establish friendships that are still a part of their life now, and it's phenomenal if you ever have a chance to come be a part of that program. We also provide within our services here live interpreters, meaning we have a Hispanic interpreter here and a Burmese, and they're available every day. And if they should go on vacation, heaven forbid, we do have interpreter services available to you. We do provide you with our pharmacy services for prenatal vitamins before you or once you get going in your prenatal care. The other thing is, outside of the centering program, when we're back just in general OB care, we have a really unique program that if you happen to be a tobacco user or use marijuana of some type, there's a program that's trying to encourage health during the pregnancy. And if you test positive in the beginning of the pregnancy and are able to commit and fully complete the pregnancy by being tested and continue to be negative, at the end of that time, you're given 6 months of free diapers, which is an amazing incentive, but a nice bonus at the end of the thing. The other thing that we want you to be aware of is pregnancy in itself can be very traumatic. Some people didn't anticipate a pregnancy, and maybe most of us think that maybe that's just the teenagers, but the greatest unplanned pregnancy is actually women over 40. So we have women that are greater than 40 that find themselves to come upon a pregnancy that they weren't planning on. But we are very good at understanding maybe the traumas or the stresses or the mental health conditions surrounding a pregnancy that's maybe unwanted or unplanned or even desired, but then they find themselves in a dilemma where this pregnancy is just a really difficult thing with all the other life stressors that are around it. A wonderful part of our care is behavioral health on campus here at Grace Health. Should we find one of our patients be in crisis state, that day, within minutes, we have someone available to them to help them in their time of need. The other nice thing about the mental health services within the OB care is our midwives have gone on to specialized training specifically for mental health conditions within pregnancy. And it's not just up to the time that you deliver. Within a year after your delivery, that is considered postpartum period. And after a baby's born, you think, oh, great, I got my baby, but it is hard. It's hard work. You're tired. You're exhausted, you may have to return to work, or you may have other children at home, and can be a very difficult time. We do a good job of taking care of our moms, not only during the pregnancy, but through that whole year and then even beyond, because Grace Health mental health program is phenomenal. And if we wean you over to primary care after a year, or even before, they have those services available to you to go forward in your life. Grace Health does another excellent job of being a partner with other services in our community. And one amazing program is a service called Milk Like Mine. This is a program that initially started out to support our African American women to try to, improve breastfeeding to them and support them during this time. And this program is phenomenal. It's located in Battle Creek. They work with us closely. They work with us at the hospital. They have done a beautiful job when we've had a sad situation like a pregnancy loss, and they've supported our women during those times too. So that's a very close relationship that we have, and we're very proud of it. Within that program, they do have people that are moving towards becoming midwives, and they do have several doulas that support you during your pregnancy, and we love working with them, and then beyond after you deliver. The family nurse partnership you talked about? Okay.
So we also will connect to something called Maternal Infant Health Program, and that is a home visiting program for pregnant people, infants, and their families. They're going to get support from nurses, social workers, other professionals that's specifically catered. So they can come to your home. Sometimes it's just through text message to support you, either during your pregnancy or after pregnancy. And it's a wonderful program. Two of the programs are called 20 Hands and Nurse Family Partnership. And then I believe we have a residency OB program. Do you want to talk about that, Patty?
So Western Michigan Medical School has had residents coming here for several years, and within the residency program, the residents, it's a 3-year program, but in their last year, they have OB patients that they follow throughout the pregnancy. They once that patient is in labor, they go to labor and delivery, and they follow the patient through the labor process, through the delivery, and then afterwards they take care typically of the baby and the mom, and it's a beautiful program, and they do a really nice job, and they work with us as the midwives because they're often asking questions about what to do, and they work with our physicians. It's just really nice, and they're very, very good students. As far as OB, I think that kind of covers it, except for one other thing. A lot of our patients are pretty healthy and things are good, and you come in and you go for your prenatal care, you have a baby, and you move on. But some of our patients are already diabetic, maybe have high blood pressure, maybe have some other medical conditions that would put their pregnancy at a little bit higher level of risk. We work very closely with Kalamazoo Maternal Fetal Medicine, which are what we call perinatologists, which are a little step up from OBGYN, specializing in high-risk OB. We work very closely with them, and should you be a diabetic, we still take care of you, but if you need insulin or anything like that, our maternal fetal medicine physicians work with us to provide care for you. We still do deliver you in Battle Creek, and the follow-up for any additional needs that are necessary would be with a consultation with the maternal fetal medicine. There are some other things where maybe a baby, we detect a cardiac or heart condition, and if that happens, then sometimes we work with the University of Michigan, who has a pediatric cardiac team that if you needed immediately to have your child have a surgery, then we would transfer you to probably University of Michigan. So there isn't anything that we can't handle at Grace Health that we can't also reach out to the high-risk doctors in whatever arena is necessary to make sure that you get through this pregnancy and beyond, healthy for you and healthy for your baby. Okay? So there's another element of what we provide in the OBGYN clinic at Grace Health, and it's gynecology care. a lot of people are thinking that, oh, Grace Health just does babies, but we do care for women as young as I've taken care of children like 11 or 12 that have had, it may sound strange, but abnormal bleeding problems. And when their periods first start and they're very painful or very bothersome. And I've worked with children as young as that to try to manage their periods. And then I've also taken care of women that are up into their 80s that may have some kind of abnormal vaginal thing or a prolapse. Prolapse means the bladder's kind of fallen out ahead of its time, or their uterus is falling down, or they're having abnormal bleeding too. You can have abnormal bleeding in the early part of your life and throughout your pregnancy, or not pregnancy, throughout your life, where we might have to do some other interventions to help you with maybe medication or to move you on to maybe a surgery that might be necessary. So gynecology care is not just when you're 40, it's all the way. It's early in life, all the way to greater age in life. Within the gynecology clinic, we also feel really strong about prevention of pregnancy. So that's important, and we have incredible services and different options to help you prevent a pregnancy. There are pills that you can be on, there are shots, there are implants where we insert a device into your arm to prevent pregnancy for 3 years. There are IUDs that can go, sounds a little invasive, but it actually goes up inside your uterus and prevents pregnancy for up to 8 years. So those are available to you too. Another piece about the GYN care related somewhat to pregnancy is preconceptual education. Like there are people that say, you know what, I don't want to get pregnant right now, but in 3 years I'm thinking about it. What should I do? What should I do before I get pregnant? And let's just imagine that maybe you have diabetes or obesity or high blood pressure. Then we would make every effort to help you and encourage you to get those things under control so that when you get to the point where you really want to have a family, we have helped you get to a healthier place. We get you to a healthier place so that you'll have hopefully a greater success in the pregnancy, achieving pregnancy and maintaining a pregnancy and having a baby. So that's important, preconceptual counseling and teaching. The other things that we can manage in the GYN clinic are some people have really bad pain when they're having periods, and we can help you with the management of the pain. The other thing is some people, you'll hear them talk about, I get ovarian cysts. Most women have 2 ovaries, and sometimes on those ovaries, these cysts start to form. And when they start to grow bigger, they put pressure in that part of your body, and you will have pain. And so we can manage that. We can help you with that. We can control some of that pain. We can give you certain medications and things where those cysts don't form every month, so to decrease the overall pain. Within the GYN clinic, if you don't want to have a baby anymore, we have the ability to have you get your tubes tied if you choose to do something more permanent. And also the other side of it, because men are a part of this thing too, the regular Grace Health has a physician that can do vasectomies for the men. So one other thing that we're very strong about is getting pap smears. Pap smears are a very important thing. Cervical cancer is the one cancer that is very preventable, especially for women. Cervical cancer is a slow-growing process that it doesn't just happen like next week or in a year. It usually takes 10 to 15 years to slowly kind of progress. And so getting a PAP when it's necessary is very important as a preventative measure, or as a preventative as far as if it's starting to progress towards a higher potential of cancer. We can intervene. We can remove some of those cells that are abnormal. We can do other things that are necessary. And so within our GYN clinic, we are able to do a procedure called colposcopy. And that's where we look right at your cervix, and we look and we see, does it look really bad in there? And should we take some biopsies to see if there's some kind of disease going on? And that's a scary thing for people when you think about it, but that is like a life-saving procedure. a very life-saving. If we find disease, we can eliminate that disease before it would ever turn to cancer. So years ago, some of your grandmas and moms or whatever used to get a PAP every single year, but now it's a situation where we do them every 3 or every 5 years typically. And sometimes it's closer, but most of the time it's every 3 or 5 years. The first PAP for most women is at age 21. Years ago, the first time that you happened to engage in intercourse, that's when a mom would drag you in and you would get a PAP. But that's no longer the case because we do know that cervical cancer is a very slow growing thing. So we can help you with that. And that's a scary time to have your first PAP. And our midwives and our doctors are amazing at talking you through that. All right.
So if you have any questions, general questions, please send them in. We're here to answer those today as well.
Okay. Another thing that we have available to you within the GYN clinic is vaccinations. We have, when I was talking earlier about cervical cancer, we do know that cervical cancer is present 99.9% of the time when a virus called human papillomavirus is present. When that virus is present, and the high-risk virus types, there's many different numbers, you have a greater chance of progression to cervical cancer. It doesn't mean that you're going to get it, but if you have HPV, we have to watch you more carefully. There is a vaccine that we can give both men and women up until age 45. If you happen to be a carrier or been exposed to HPV, you can get the vaccine. You can also get other vaccines, general health vaccines within the GYN clinic.
So something else community health workers do in the OBGYN clinic, we visit our patients. If you are coming in for a 12-week initial OB appointment, we will meet, myself or a coworker will meet with the patient to complete what's called a health risk assessment or prepare. You may hear that as something that has to be done yearly. And from that assessment, we can identify any resources that you may need and give you those at that visit. We also will meet with our OB patients at the 30 to 34 week appointment. At that appointment, it's really nice because it gives us time to go over all baby resources, I say, and that will help us to identify if you're in need of a pack and play or safe sleep environment, a car seat, and if eligible, we're able to do those referrals with you or give you that information for you to make self-referrals. There's a lot of great community programs for that. And we also at that appointment will go over that safe sleep education and shaken baby syndrome and give those resources as well. And then our other role as a community health workers, we have a partnership with Bronson Battle Creek, and we will visit once the patient has delivered. A community health worker like myself or a coworker will visit if it's during the week and come and offer your postpartum, newborn appointments, any resources that maybe we didn't identify prior to delivery and assist with giving those to you. We work closely at the hospital, the birthplace at Bronson Battle Creek, with their social work team and postpartum support nurse to make sure hopefully you have everything you need to go home from the hospital.
So a question that just popped up, can teens get confidential STD testing? That's a tricky one. Within Grace Health program, some schools have school nurse program there, and confidential STD testing can be done at the schools. It kind of depends on if mothers show up with their kids or if you just show up by yourself. Probably the other option is to to just meet with your pediatrician, and they can probably provide that. But it's different in different arenas. It's different if your mom shows up with you. It's different if you come in by yourself. Oh, that's a good question. Do the midwives do home births? Our midwives do not do home births. There are different levels of midwives. There's a lay midwife. There are the midwives at Grace Health are certified nurse midwife. We have advanced education. We pass a board test, and we have to practice within the standards of care that both the OBGYN community does and the midwifery community does. So as a practice at Grace Health, we don't participate in a home birth. There are other midwives in the community that do participate in that. We do feel strong, though, that we provide as close to being at home kind of birth as possible. We are very low intervention as far as labor. If you don't want a whole lot of, if you don't want pain medicine, if you don't want IVs, sometimes we can have a discussion, and we try to let the natural process happen and let your body do what it's trained to do. Your body knows how to labor. Now, sometimes things get a little squirrely and we have to intervene, but as far as laboring with our midwives, you can be rest assured that we're not going to just strap you down, tie you in, and that's the only way that you're going to have a baby. Now, with that said, we are trained that if there is danger to you or your baby, or there's a health concern, we will intervene. We will talk to you absolutely about why we're concerned. We're concerned about your health. We're concerned about your baby being in danger. And in those situations, we will do a lot of intervention in order to make sure the mom's safe and the baby's safe, and we have a healthy outcome. So that's it as far as home birth. There's a question about your shaking baby.
Okay, so they're asking, what is shaken baby syndrome? Could you explain the background to that?
Yeah. So what history has found is that when you have a very small infant and you have a developing infant, the brain, if someone were to grab the baby and just start shaking the baby, that the soft matter in the brain goes forward and backwards against the hard bone, and it can do serious damage to the brain of the child. Permanent damage, where babies don't function very well in the long term. Some babies have died from that. Some babies just have long-term damage. So that's what the shaking baby thing is, rattling the brain back and forth. Another question is, at Bronson Hospital, years ago there used to be like 5 different OB groups in Battle Creek, and now there are basically 2. There's Grace Health providing OB care, and there's Bronson OBGYN. And within this community, we are a really strong partnership between the 2 organizations. We support each other in labor and delivery. There are times when I am working with a Bronson doctor at the hospital, and I'm there, like I'm going to be on call on Thanksgiving for 24 hours, and whoever comes through the door, be it a Grace Health patient or a Bronson patient, I will be doing their delivery. And then there is a doctor in the hospital at the same time in case of those emergencies we talked about before. Should there be an emergency C-section or something that needs intervention, the doctor's there to perform that. So whenever you come to care for OB at Bronson, you get a midwife and you get a doctor to take care of you. The majority of all deliveries, vaginal deliveries, are done by the midwives, either the Bronson midwives or the Grace midwives. And it's basically whoever's on call. Every 24 hours, some of the midwives work 12 hours, but every 12 or 24 hours, there's a new midwife available to work. And then sometimes the doctors work longer shifts, but about every 24 hours, a new doctor will come in too. And that's a partnership that we've had for a number of years, and we see that that will continue for a number of years going forward. Please give us some questions. Well, I'm going to go back to one area that I totally forgot, and that's in the GYN arena, and that's for menopause. Menopause. Some people cruise right through menopause and they're not having a problem, life's good, they move on. But for some women, menopause is a very, very difficult time emotionally. They feel like I was living my best life, then all of a sudden my ovaries quit and I am an ornery ass. Oops, sorry, I am ornery. And their moods are up, their moods are down, they're having hot flashes, they're trying to sleep and they're turning the covers off and then back on, and it's just a very trying time because they had lived for probably 50 years with estrogen coming out of their ovaries, and now all of a sudden the ovaries decided to retire and not give you any more estrogen. And that withdrawal of estrogen can be a very difficult thing for a body. So menopause is a lot of different things to different women. Like some people come in and it's the moodiness. Some people it's the hot flashes that they hate. For some, sex is different. Now all of a sudden it hurts when I have sex. Sometimes the sexual desire is gone in menopause and they had a great sex life and then all of a sudden there's no estrogen on board and they just could care less. So all of those things are part of menopause, and all of those things we can help you navigate and get an improved life and feeling and feel like yourself a little bit better. So don't hesitate to come and get help for that. Question is there routine STD testing? Whenever I'm going to back the train up a little bit. In the younger years, earlier years, there tends to be more sexual partners. I'm not saying that for everybody, but as a rule. And when there's more sexual partners in your life, there tends to be a higher potential for obtaining sexually transmitted diseases. What are those? Those things are things like a thing called trichomonas, gonorrhea, chlamydia, syphilis. You can get hepatitis, you can get HIV. All of these things can be passed or received from another partner. And all of those types of testing are available here, not only in our GYN clinic and our OB clinic, but also in primary care. Anytime there's a new sexual partner, I would highly encourage someone to get STD testing. You do not know. A lot of times partners don't know that they're carrying something or that they're passing something on. So, and a lot of times men don't realize that they have it, or women don't even realize that they have an infection. So if we routinely screen somebody just at an annual exam for a routine PAP and we say, would you like to have testing, and we do it and it comes back positive, a lot of times the woman didn't even realize that she had it. So it's very good to be tested frequently.
And the final question is, when would you come to Grace Health instead of going to the emergency department?
Okay. We can routinely test you for urinary tract infections if you think you might have a bladder or kidney infection. If you're having just irregular periods, that is really not a state of emergency. You should come and make an appointment and come and see us. What would be emergency-driven care would be severe abdominal pain. That you can't stand, you can't walk, this is something like you were fine and now it is so intense that you might be vomiting, you're rolling around. Those can be emergent situations. You could have an ovary that twisted on itself, and that's called a torsion. And if it twists and it continues, you lose the blood flow going into that ovary, and then that ovary could die. So that's an emergency. If you are bleeding, and when I say bleeding, just a little bit of blood, that generally doesn't count. But if you're passing clots the size of my fist, one right after another, and that continues to go on for an hour, I would go to the emergency room. You're hemorrhaging, but we don't know why. What are you hemorrhaging from? So they can investigate that. The other issue is, especially in pregnancy. Now, this is not GYN. We're going to go back to pregnancy. We have a lower threshold for you coming in. We want you to come in if you have, now in this situation, if you have small amount of bleeding and you're pregnant, we want you to come in. If you're just gynecology and having a little bit of bleeding, that's a whole different thing. Bleeding in pregnancy is unacceptable behavior, okay? The other reason why we want you to come in for emergency in pregnancy was my baby's not moving. My baby's been moving every day, and this baby is not moved. You don't wait until tomorrow. You don't wait until you finish the birthday party. You need to come. If there's something going on in emergency state in your baby, and you come in at that moment, and something can be done to intervene and possibly save your baby's life. Sometimes the baby's telling us, I'm not able to move, and maybe there's a cord around the neck or something. But the body knows and the baby knows, and so no fetal movement is a very important thing. Any kind of trauma, and again, I'm going pregnancy, any kind of trauma to your belly. You're in a car, you're driving along, and somebody hits you. Your seatbelt pulls really hard. It pulls your belly hard. And so when you jar that belly where the placenta is or anything like that, you can loosen that placenta up and you could put the baby in danger. You need to come at that time. You don't wait for a day. You just go from the accident right to the hospital to make sure your baby is okay. Okay.
And Grace Health offers our 24/7 nurse line as well. So that's available for our patients too.
And that's like at the office is closed, you call and you say, hey, this is going on, what can I do? And they will advise you. They have a protocol that they will guide you in the appropriate way to go. And a lot of things, you're just concerned, you don't know what to do, and they will say, you know what, I think you're okay, call tomorrow, make an appointment. And they're very good at sending patients to the hospital appropriately, so please use that number to call, just for an extra reassurance or guidance as to what's going on.
We just want to thank everyone for joining us today, and we wish everyone a happy Thanksgiving.